Hello everyone, welcome to Unify Husky YouTube channel. Today we are still going to continue with A to E assessment of a patient that have head injury or subdural hematoma in case of GCS. Instead of using the news charts for this kind of patients, we are going to be using a GCS chart because GCS assessment is going to be carried out on this patient. And for this patient, we are going to see, follow the normal pattern by asking for the name of the patient, the allergy, if the patient has been resting, and the about whether the patient can hear and see me well, comfortable at the moment, but we are still going to have additional question about the day or the date just to be able to check whether that patient is oriented or is confused. So that is um what I can say for now about the GCS assessment introduction. Now I'm just going to start straight away. I ensure that the room is safe as I approach my patients. I try to provide privacy by drawing the curtain. Then I follow WHO and standard of hand hygiene to perform my hand hygiene. I apply an amount of gel on my head. I rub my hand palm to back of my hands with fingers interlaced, palm to palm with fingers interlaced, back of the fingers with fingers interlocked, tips of the fingers, rotation of the thumb and my wrist. I wait for 30 seconds for my hand to dry, then I move close to my patient. Hello, my name is Joy. I'm your attending nurse for today, and I'm actually here today to carry out an assessment on you, as well as to ask you some questions regarding activities of daily living. And for the assessment, I will be following A to E assessment. Is that all right by you?
Yes, go ahead.
All right, thank you very much. Can you please tell me your full name and your date of birth as I compare it with what I have on my documents as well as your wristband? Can I have a look at your wristband, please?
Go ahead, Nurse Janice Morgan, date of birth 1/1/1940.
All right, I've confirmed I'm with the right patient. How would you like me to address you, please?
You can call me Morgan.
Oh, all right, Morgan. Morgan, have you got any allergy?
No, I don't have any allergy, nurse.
Oh, I'm happy to hear that. So, Morgan, have you been resting for the past 30 minutes?
Yes, I've been in bed since morning.
Oh, all right, that's good to hear then. Morgan, can you see
Yeah,
and can you hear me well?
yes, I can.
Very good. Are you comfortable at the moment? Is this position okay for you?
Nurse, I can't even see. My head aches a lot. I'm in
Oh,
pain.
I'm so sorry to hear about that, Morgan. Let me just put a pillow at the back of your head for now. And if I ask you to rate your pain from 0 to 10, 0 mean no pain and 10 being the highest level of pain, what score do you give it, please?
I would say 7.
Oh, that's a lot. I'm so sorry to hear about that. Once I'm done with this assessment, I'm going to have a look at your medication chart to see if you are due for any analgesic. If you are due for any, I'm going to administer it straight. And if not, I'm going to escalate to the medical team, okay? Just to review
Okay.
you and prescribe an analgesic for you. But meantime, you can just take a deep breathing. You can take a deep breath, okay? And I've already
Okay.
adjusted your position. You can also involve yourself in some diversional therapy just to take your mind off the pain for the moment. But once I'm done with this assessment, I'm going to address that. Is that all right by you?
Okay, nurse, thank you.
All right, thank you very much. So I'm just going to leave you for a while now, Morgan, to quickly go and gather the materials I will be needing for this procedure, and I will be back shortly. In case you have any
Okay.
concern, your pen is right here, where you press it, and I will be here as soon as I can, okay?
Okay, nurse.
All right, as I leave my patient side, I perform my hand hygiene again using gel. Assessor, can you please confirm to me that this apparatus has been calibrated within the last 24 hours according to hospital policy?
Yes.
All right, I put on my apron, I put on my gloves, and I move the BP apparatus close to my patient's side. Hello, Morgan.
Hi, nurse.
All right, yeah, I'm back to carry out the assessment. But before I go on, there is one more question I would like to ask you. Do you know what today's date is?
Yes. Today is 14th of February, Valentine Day, nurse.
Oh, I'm so happy to hear that. So you know that today is Valentine's Day. That is
Of course, I know.
fantastic. All right. What is today? Is today Monday? Is today Tuesday or Wednesday or Thursday, the day of the week?
Today is Saturday.
Today is Saturday. Oh, Morgan, I'm sorry. Today is not Saturday. Today is actually Monday. Okay. All right.
Oh, I see. Yeah.
All right then. We just start with checking your blood pressure. Okay. Can I make use of your right hand to check your blood pressure?
That's okay.
All right. I examine the arm to be used for my patient. I can see that there's no sign of inflammation or infection. I'm happy to use the arm. I have already ensured that I have the right cuff for my patient, and I wrap it around my patient's arm, not too loose, not too tight, about 2 cm above the antecubital fossa. And while that is measuring, I'm going to be checking my patient's oxygen saturation level. Uh, Morgan, I will be making use of your left hand finger. Is that all right by you to check your HbO2?
That's okay, nurse.
All right, I can see that the finger is not cold, it's not clammy, there's no nail varnish. I depress it and I can see that the capillary refill is less than 2 seconds. I'm happy to use it. I attach the oxygen probe, and while that is measuring as well, I get my tympanic thermometer, attach a new probe cover, and I will be checking your temperature by making use of your right ear. Is that all right by you?
That's fine, nurse.
All right. Examine here, I can see that there's no hearing, there is no sign of inflammation, there's no fluid discharge. I'm happy to use here. I insert my thermometer and now it has blipped. Finished taking the temperature. I discard the probe cover inside the clinical waste bin after taking notes of the reading. Then I unwrap the BP cuff. I also remove the oxygen probe. I keep it aside after taking notes of the reading. And Morgan, I will ask you to try and remain quiet for the next 2 minutes, okay?
Okay, nurse.
All right, thank you very much. I just want to check your heart rate, and I'll be making use of your right wrist if that is okay by you.
That's okay, nurse.
All right, thank you very much. I touch the right wrist of my patient, and assess on my time starts now. All right, assuming 2 minutes have passed, Morgan, I actually counted your pulse rate for 1 full minute, okay? Taking note of the rhythm, the pan, as well as the rate of pulse. I counted your respiration as well for another 1 full minute, taking note of the rising and the fall of your chest. I'm sorry I didn't inform you earlier, and that is because I didn't want, the reading to be altered. Is that okay by you?
Okay, nurse. No worries.
All right. All right. Thank you very much. So I will now be carrying out the GCS assessments on my patients. All right. So more as I said, I will perform GCS assessment. Okay, is that all right by you?
That's fine, nurse.
All right. I will be starting with checking your capillary reaction to lights, as well as your pupillary reaction to light, as well as pupillary size. Do you have any contact? Do you have contact lens on?
No, I don't.
All right, no contact lens. That's fine. So I will just want you to look straight ahead. Okay, I'm going to flash a light inside your eye. I will be starting with your right eye, then to your left eye. Is it okay if I just cover your left eye for now?
I can do that on my own, nurse.
All right, thank you very much. Can you cover the left eye for me?
Done.
Yeah. So I'm flashing the light now from outward inward. All right, that's fine. Can I do that on the other eye while you cover the right eye now?
Okay.
Thank you for humor. All right, very much, Morgan. So I'm going to be checking your muscle strength now. Okay. Can you stretch forth your two hands for me, please? I will try and put a pressure on your arm, starting with your right hand, then to your left hand. Just try as much as possible to resist the pressure. Okay.
Okay, I will.
Can you stretch your two hands for me now? All right,
Done.
I'm putting a pressure now. Okay, good. The other hand as well. Very good. You can resist it very well. We are going to repeat the same thing on your lower extremities, I mean your two legs as well. Can you raise it up for me while I try to put a pressure, then you try and resist the pressure? All right.
Okay, now
All
resisted
right.
now.
Okay. You can see that your muscle strength is normal. Thank you very much, Morgan. And now I can see, following the head to ear assessment, I'm already done with your observations, and I can see that your airway is not obstructed because you can actually communicate with me very well, and I'm happy with that. There is no sign of stridor. There's no wheezing sound. And for your breathing, your respiratory rate is actually okay. It was 18 cycles per minute. And the rising and the fall of your chest was fine as well. Okay. And for your circulation, your blood pressure is actually okay within normal range. And your capillary, your for the SpO2, the capillary refill was fine. It was less than 2 seconds, and your SpO2 was okay as well. And for the disability, you told me that you can actually see and hear me well, and that is fine. And you've been able to stretch your hand for me and your leg as well. So I'm happy you don't have any disability. I'm happy to hear about that. And I would also like to ask you, have you had a wee? Have you been to the toilet today? Have you passed urine today at all?
Oh yes, I did have a wee about 2 hours ago.
Oh, that's good to hear. Fine. Assessor, can you please confirm to me my patient's blood sugar, please?
It's normal.
Is normal. All right, that's okay. My patient is not disabled. That's fine. And for the exposure, I can see that the place that is obvious, the part of the skin that is obvious for me to see, is actually intact. Morgan, do you have any lesion or any sore on any part of your body?
No, I don't.
All right, my patient's skin is intact, as verbalized, and the part that I can see as well is actually intact. So that is the assessment, the head to ear assessment. Aside from carrying out the observations, I've been able to talk about the head to ear assessment as well. So Morgan, I'm just going to leave you for now. I will step aside to plot the observations, and I will be right back once I'm done to ask you some questions, as I said earlier, regarding activities of daily living. Okay, in case you have any concern, don't forget you have your call bell right here. Just press the call bell and I will be here as soon as I can. Is that right?
That's fine. Thank you,
Right. As
nurse.
I leave my patient side, I perform my hand hygiene again by using gel. Then I plot my observations, and I'm going to calculate the GCS score as well. All right, assuming I'm done with all that, I go back to my patient side. As I get back to my patient side, I'm going to perform my hand hygiene again using gel, ensuring that I don't miss any of the steps of the hand hygiene. Hello, Morgan. I'm back. Are you all right?
I'm okay, nurse. Welcome back.
All right. I have actually plotted your observations and I've calculated your GCS score, and your GCS score is 14 out of 15. You score 14. And that means that I'm going to be monitoring you every 30 minutes until your GCS score is 15. Is that all right by you?
That's fine, nurse.
All right. So concerning the questions regarding activities of daily living that I said I will be asking you, if you don't mind, Morgan, do you have any problem with your nutrition or as well as your hydration?
As for my hydration, I don't know, I feel dehydrated. And even the way I told you about, the quantity is not like before.
Oh, I'm so sorry to hear that. I will just advise you that you should increase your oral fluid intake, okay? And we are going to open a fluid balance chart for you just to monitor, your intake and your output. Try to increase your fluid intake, and your next urine when you go to the toilet. Let us know when you want to go so that we just, have a look at the urine to see whether it is concentrated or not. Okay, is that all right
Okay,
by you? And I
that's
will
fine, nurse.
escalate to the medical team at work for further plan of care. Okay.
Okay, nurse. Thank you.
All right, Morgan. I can see based on the history that is here that you had a fall recently. Do you have any problem mobilizing?
I don't even want to go out of this bed again. I don't want to have a fall. I'm just scared. I don't want to have another fall, nurse. I don't know how to
Oh,
manage.
oh no, Morgan, I'm so sorry to hear about that. We will just try as much as possible to assist you, with part of your activities of daily living. Remember your call bell is there. If you need assistance to go to the toilet, just press the call bell. Either me or somebody else will be here to assist you to the toilet. And I will encourage you that anytime you want to move around, just ensure that you have your anti-slip socks on, okay?
Okay,
And
nurse.
if you don't mind as well, I'll be referring to a physiotherapist as well as occupational therapist for further plan of care. Is that all right?
That's fine. Thank you.
All right. And as regards the pain, you complained about the pain the other time. How is the pain now?
I think it's a bit better, but if you can get me some painkiller, I wouldn't mind.
All right. So sorry for that. I've repositioned you and I'm going to have a look at your medication chart. If you are due for any medication, as I said earlier, I will come back to give it to you. And if not, I'm going to escalate it immediately to the medical team to review you, so as to, prescribe an analgesic for you. Do you have any other concern? How is your social life like?
So I don't know my social life. I don't think I want to talk about it anyway. Yeah, I don't.
All right, that's all right. There's no problem about that. Do you live alone?
Yes, I live alone now because my partner left some time ago. So it's okay. It's fine.
It's all right. It's all right, Morgan. So that will be all for now. In case you have any concern, don't forget you have your call bell right beside you here. Just press the buzzer, and I or somebody else will be here as soon as we can. I'm going to leave you for now. Thank you so much, Morgan, for your participation. I leave you for now. Then, as I
No.
leave the patient, I perform my final hand hygiene by making use of gel as well, ensuring that I don't miss any of the steps of hand hygiene. And I'm going to go back to check my chart to be sure that I've documented everything correctly, and I will ensure that the apparatus that I use, is clean to be kept for the next use. And that is all about GCS assessments under new Osce. Thank you very much for watching. Bye.